Dealing with a narcissistic husband can be complex and challenging, but there are strategies to manage the situation effectively. Here's a detailed analysis in bullet points. Understanding narcissism. 1. Educate yourself about narcissistic personality disorder, NPD, to better comprehend your husband's behavior patterns and tendencies. 2. Recognize that narcissism often involves traits such as grandiosity, a sense of entitlement, manipulation, and lack of empathy. Establishing boundaries. 1. Set clear and firm boundaries to protect your emotional well-being and prevent manipulation or abuse. 2. Communicate your boundaries assertively and consistently, refusing to tolerate disrespectful or harmful behavior. 3. Be prepared to enforce consequences if your boundaries are violated, such as disengaging from arguments or seeking support from a therapist or support group. Self-care and support. 1. Prioritize self-care practices to nurture your mental and emotional health, such as exercise, mindfulness, and hobbies. 2. Seek support from trusted friends, family members, or a therapist who can offer validation, empathy, and guidance. 3. Take breaks from interacting with your husband when necessary to recharge and maintain perspective. Communication strategies. 1. Approach conversations with your husband calmly and assertively, focusing on specific behaviors rather than attacking his character. 2. Use I statements to express your feelings and needs clearly without blaming or accusing. 3. Practice active listening and validate his feelings when possible, but remain firm in upholding your boundaries. Managing expectations. 1. Accept that you may not be able to change your husband's narcissistic traits and behaviors. 2. Adjust your expectations and focus on managing your own reactions and responses to his behavior rather than trying to change him. 3. Consider the long-term impact of the relationship on your well-being and explore options for setting boundaries or seeking support if necessary. Seeking professional help. 1. Encourage your husband to seek therapy or counseling to address his narcissistic tendencies and work towards personal growth. 2. Consider couples therapy as a means of improving communication and addressing relationship dynamics under the guidance of a trained professional. 3. If the relationship becomes emotionally or physically abusive, prioritize your safety and well-being by seeking assistance from domestic violence hotlines, shelters, or legal resources. Exploring options. 1. Evaluate the feasibility of staying in the relationship versus leaving if it becomes emotionally or physically harmful. 2. Consider consulting with a lawyer to understand your rights and options regarding separation or divorce. 3. Explore individual therapy to process your emotions, gain clarity about your needs and priorities, and make informed decisions about your future. By implementing these strategies, you can navigate the challenges of dealing with a narcissistic husband while prioritizing your own well-being and maintaining healthy boundaries in the relationship.